Get started. Thank you to everyone who's joining us today. My name is Krista Deans and I manage public relations for San Ramon Regional Medical Center. Welcome to our Lunch Chats, Keeping You Healthy series. We developed this series to introduce different medical experts to the community and have them discuss a variety of topics from healthy habits to updates in medicine and everything in between. And today we have the pleasure of introducing Dr. Hasan. He is an orthopedic spine surgeon here at San Ramon Regional. And he went to NYU for his orthopedic spine surgery residency. He completed his ortho neuro fellowship in spine surgery at Cedars-Sinai in LA. And he also did extra training in minimally invasive and endoscopic spine surgery at the University of Washington in Seattle. So today he's going to be talking with us about neck and back issues in the time of COVID, which is very relevant right now. So thank you so much for joining us today, Dr. Hasan.
Yeah, well, thanks for having me, Krista.
Of course. So I'll just let you go ahead and get going on your presentation.
Perfect. So I'll just jump right into it here. Let's just see. So can you guys see the screen?
Yep, there it is. Perfect.
All right, perfect. So we're going to be talking a little bit about neck and back issues related to COVID. This is obviously a lot of patients I've been seeing in the office have been coming with neck and back issues, and the increasing frequency of that I think is related to a lot of staying at home and working from home. So we're going to go over some basic topics, kind of understand what the role of spine surgery and seeing a spine surgeon is in terms of your neck and back issues, and just some basic understanding of why we do have neck and back issues. So for an introduction, I just want to talk a little bit about orthopedics. So what is orthopedics? Typically, it's just the treatment and diagnosis of any problems related to bones, joints, ligaments, tendons, muscles, and nerves. And the goals of orthopedic surgeons really to diagnose and treat these problems and really return patients back to normal function and movement. And to understand what normal is, it's really good to kind of understand what abnormal is. And abnormal would be any kind of pain and limitation associated with different activities that we do in our normal life. So what I'm going to focus on is a subspecialty of orthopedics, which is spine problems, which is related to neck, upper back, and lower back problems. And really, this spans a whole gamut of different problems, and I'll kind of try to keep it basic so it's very much relevant to the general public. Now, back issues are not uncommon. I mean, there's an incidence of almost 80%. It's the most common musculoskeletal pain that people experience. Neck is not as common, but it is up to 70%. So at any given time, 31 million Americans experience low back pain. And that's a pretty significant number. And if you look at this chart here, this is a National Health Institute study that looked at the most common reason for missed work was actually back pain. And it's the second most common reason for a visit to a doctor. And you can see there's other types of pain which are related to back pain, which is sciatic pain, also nerve pain, et cetera. But really, you can see this is a really big issue. And this is a recent article. It's pretty interesting. Came out of Atlantic in 2016. It looked at in a 15-year period, or actually 25-year period, there was a tremendous increase in the amount of low back pain throughout the world, and it's considered one of the biggest cause of disability around the world. You can see from 1990 to 2015. In 1990, globally, the low back pain was ranked as number 12. In 2015, it shot up to number 4. And a lot of that is because, overall, we're getting better at taking care of people. And as a result of that, the patients are living a lot longer. And you can see this graph here that generally our population is getting a lot older. But another important component of this, which is more relevant to today, is that we have evolved to be bipedal animals who stand on 2 feet and stand upright. But as we get more and more immersed in technology, you can see that we're kind of getting these different postures and the type of work we do, and we're kind of essentially going against what evolutionary made us stand upright. So you can see that, especially during COVID, that there's a big issue with neck and back problems, And that's related to just poor posture, honestly. And we'll talk a little bit more about that later on. But this is an article from New York Times, it was published pretty recently. So looking at a survey from chiropractors who said that the amount of patients coming in for neck and back issues has just been skyrocketing. And that's really just patients are hunched over their couch or their kitchen counter trying to do work. And really, we don't understand what good posture is and how that can actually impact general back and neck issues and what that can result down the line. Now, this is another study that came out recently looking at just pain. And you can see that not only are we having more pain from just being hunched over and working from home, but just the COVID in itself, it causes a lot of psychological and social stressors. And there's enough studies to show that if we already have pain, that all these psychological and social stressors can actually increase the amount of pain we're experiencing. So to really understand the spine, you have to understand what the spine does. And really, we have to understand that the spine provides function and form. And that's based on the anatomy. And how does it provide function and form? So, well, without our spine, we're like jellyfish. We don't have any structure. We have no way for our arms and our legs to anchor to our body. And that's why they describe that, the spine as the core, the foundation, is because that's where everything is built. All movement comes from that. And you can see that with the spine, we have these discs, and these discs allow for nice fluid motion. Again, this is a very important function. So the spine provides structure, support, and function, and in terms of movement. And with these discs, we also allow us to have flexibility. You can see that now we might not all have this kind of flexibility. I know I don't, but in terms of what the spine allows us to do with the complex interaction of joints, that allows us to move in space and to partake in different functions in life, whether it's athletic activities or just kind of lifting something off the floor. So I want to talk a little bit about what the spine anatomy is, because I think this is very important. So you have to understand the spine and how it functions, and to then understand where it goes wrong. Now you can see the spine is divided into the vertebral column into about 3 sections: the cervical, thoracic, and lumbar spine. And these compose about roughly 24 bones. These are called vertebra, and they have a front part, a back part, and they're anchored together with these discs. We'll talk a little bit about. And essentially, that you have the disc in the front, which is sort of a joint in a way, and then you have a joint in the back called the facet joint. And now, what the spine does is, with the complex interaction of these joints, as well as muscles and tendons attached to these bones, they allow us to move like we previously described. So when someone talks about your cervical, that's this area here. Thoracic is the mid-back, and the lumbar is the lower back. And then we have the sacrum and the coccyx as well. So what I really want to talk about, which is the most important thing, part of the spine, is the disc. Now this is a disc, a cross section from a journal where we talked about that. The disc, the best way to describe the disc is almost like a juicy scallop, okay? And this juicy scallop almost has the inside, which is kind of like a jelly-like structure, which is kind of like this. And this is what gives us that compressibility that exists in the spine. It gives that flexibility. And what this disc does, allows us to essentially have coordinated movement by offloading forces throughout different discs in the body. So what happens to the disc? Well, through a combination of different things I'll talk about, the disc can change. It can go from this nice juicy scallop, and you can see these pictures. Again, this is a busy slide, but you can see how this disc initially looks, and as a combination of age, wear and tear, genetics, etc. You can see that the disc changes its quality. And as the disc changes its quality, it can affect different parts of the body, different parts of the spine. It can affect the facet joints in the back, which I talked about. And it can essentially affect mobility, and you can end up having pain from a disc which is kind of worn and torn down. So this is a nice little video which shows, so this is a normal disc here, and you can see what happens to a disc over time. So you can see that, if a problematic disc can actually, you can see it can shrink like that. And as it shrinks, you can see the nerves are coming out of these holes here. These are called the foramen. And what can happen is that the area for the nerves can decrease, okay? Now, this is another view of the same disc. You can see that nothing that can happen is that the disc can herniate. Now, we talk about herniated discs, we talk about, bulging disc and all these things. It's really part of the same spectrum. The idea is the disc has become abnormal, and the abnormality results in some kind of compression of the nerve which comes out here. And you can see this is a herniated disc, this is a ruptured disc. The idea is the same, that you're having a disc changing its quality and result in compression of a nerve, okay? Now, this is a video which shows what happens if a disc shrinks in the front and what can happen globally in the spine. Again, this is the disc. These are the joints in the back. Okay, these are facet joints we talked about. Now you can see as a disc shrinks in size, okay, you can have the nerves being compressed in the back, and they highlight that. I guess red indicates pain. So, and then what happens as you keep going along, you turn around and look at the back, you can see arthritis forming. Now, what is arthritis? All arthritis is a catch-all term, and all it describes that a joint is being worn down. And you can see all these bone spurs forming. This is not a normal looking joint anymore. And you see how it's all related. So sometimes if you have a problem in the front of the disc, it can cause problems in the back right here, causing arthritis in the joints. Now, all in all, this is kind of like a spectrum that happens, and we'll talk about why it happens. Okay, so again, why does it happen? Well, it's really a combination of different things. So age is an important part of it. As we get older, our discs lose their normal structure, and we can end up going down this path. Another thing that can compound it is genetics. Some people have a genetic predisposition to having early problems with their discs and their spine. Another issue is the type of work we do. Sometimes we can be involved in work, for example, construction work where there's heavy lifting. We may not practice the best mechanics when lifting and doing things. We can put undue stress on our back and on our discs and our joints. It doesn't even have to be construction work. It could be, a desk job where you're always sitting and looking at a computer or doing some desk work where your neck is always cramped down in an abnormal position, and that can also wear away your disc. So lifestyle is a very, very important part of back and neck problems, and that's actually, it works out for us because that's one of the things we can actually control, because you can't control age and you can't control genetics. Another thing we can control is posture and mechanics, and this kind of relates to the work environment. How you sit, how you use your phone, how you walk. All these things are things that we have a direct impact on, which can essentially prevent further problems down the line. So what I want to give you is some really helpful tips to have a healthy spine. And I'm going to start with tip number 1, and that is, it's pretty common sense. You have to exercise daily. So a lot of what's going on with this pandemic and this work from home restrictions that we have right now is that people are just spending all their time sitting in one spot. They're not exercising. Since you have time to be home now, you have to create a regimen for yourself to be able to exercise daily, because movement is function and movement is key, and really movement is life. So you have to spend time moving to get your spine to have less problems. Now, a lot of exercises that we like to talk about are exercises that focus on core work and flexibility. Now, these are 3 exercises that were kind of made famous by a Dr. McGill. They're called Dr. McGill's Big 3. And really, he did numerous amounts of testing to find which 3 basic exercises that you could do that will encourage increased core stability. And the increased core stability will essentially offload pressure off your disc, because the better core you have, that means there's muscles that are helping keeping your spine upright, and there's less pressure on your discs and joints in your spine. So that's why I say these 3 are pretty important in terms of incorporating into your daily routine. Now, in terms of flexibility, I think in terms of yoga, yoga has a tremendous benefits on flexibility and overall spine health. And these are some basic exercises you can do that I myself do that help with maintaining flexibility, whether it's both knees to chest, the cat-cow, child's pose, downward facing dog, etc. These are really important components to having these routines as part of your everyday life. Tip number 2, you have to decrease your phone time. I can't tell you how many times I stop and whether I'm waiting in line somewhere and I see everyone around me with their neck cocked forward, diving deep into the Instagram or whatever else they're doing. And it's just that poor posture, it's just going to catch up with you eventually. So what I want to talk about a little bit is text neck. Now, this is a great article, an infographic, which shows that if you have an upright head when you use your phone or cell phone, there's minimal pressure on your discs. Okay, and imagine if you remember physics, your head essentially a certain amount of weight, and as you start tilting with the angle, there's then going to be a corresponding increase in force that goes into your neck, and that will be distributed to your neck muscles. It'll be distributed to your neck, your discs in your neck, as well as the joints in your neck. And the more you bend forward, the more that force increases. You can see that force goes up to almost 28 kilograms when you have a 70-degree bend in your neck. So the biggest thing I'd advise, if you're going to use your phone, I know everyone does, try taking your phone and just kind of keep your neck straight and look at it like this. This will be a lot better for you, and you'll notice a difference, right in the first week or two of doing that. Tip number 3, fix your posture and your mechanics. You can see this. This is a great example of a poor posture. This is Mr. Burns, and you can see that posture it's easier to understand posture when looking at you from the side. We talk about posture from the front. Ideally, the spine is ideally aligned so that your head is sitting on top of your pelvis. A straight line goes across. Now we talk about scoliosis, which is not what we're going to talk about today. But scoliosis is when there's a curvature when you're looking at someone facing a front view. But what posture I'm talking about is posture from the side. Now, normal posture typically, again, has the neck or the head kind of centered over the pelvis. And when as spine surgeons, we always look at alignment. We draw lines coming from certain bones going down to make sure they're aligned perfectly. Now, we talk about kyphosis and lordosis. Really, the normal curvature of the spine, there's a certain degree of lordosis here. And lordosis is this curve like this, okay? And there's lordosis here as well. So normal spine curvature has some lordosis in the cervical spine. They also have some lordosis in the lumbar spine and a slight kyphosis in the thoracic spine here. So really you have this nice curvature, which is essentially the basic fact you have to understand about your spine is respect your normal curvature. So whatever you're doing and whatever we're going to talk about now in terms of mechanics, it all comes down to what the normal curvature of the spine is. Now, when you have increased kyphosis, you can see this is increased. Your neck and your head are facing forward here, okay? And that could put undue pressure on your disc as well as the muscles and fatigue the muscles. Then there's increased lordosis. Now, this is not as common, but if someone does wear high heels, for example, they will have increased lordosis just based on the fact that the way their body is standing on the heels. So that that would be increased lordosis. That'd be too much curvature here. And then there's flat back, and this can sometimes happen after a surgery. It can happen after just having poor posture. It can happen after having your disc collapse over time. But really, the take-home message from this slide is you want to have good, normal, S-shaped curvature of your spine in all activities that you do. So here are some examples of what good posture is. You can see that if we drew a line here, again, from head down to the pelvis, this is a straight line. Poor posture, again, is when you start slumping forward. We call this rounded shoulders, okay, or a rounded back. You want to avoid rounded shoulders and a rounded back because that's when you can start having back and neck issues. And again, perfect example right here. Now, the same principle applies when you're sitting down. It's not that complicated. It's really just respecting the curvature of your spine. You can see again here, you see how they're kyphotic here because they're bending forward here. And this is not the normal curvature of the spine. So your spine is happiest when you respect the normal curvature. And you can see here, not very happy. But over here, look at the curvature here. You have the nice curvature here, and then you have the curvature here. So what I recommend for you when you're working from home is really spend some time and energy and maybe money to make sure that your work home environment respects the curvature of your spine. And everybody has different degrees of curvature in their spine. So what I'd say is, maybe if you look at my chair here, you can see that I have a nice curvature around with my neck, so it matches my neck curvature, and you can't see my lumbar spine, but there's curvature in my lumbar spine as well. So you have to find some padding or some kind of pillow or some kind of thing you can get off Amazon, which can support the gap that exists to support this lumbar lordosis here, as well as this lordosis here. And you can see this is someone who's really adapted their chair to fit that environment, if that makes sense. Now, people always ask me, hey, doc, how do I sleep? How can I sleep better? And this, it's all the same thing. I always tell people, if you understand posture and you understand what good posture is, everything else will come natural. So this all kind of highlights the same thing. If you look here, your posture, you want to have a straight posture, like you want your spine to be straight when you're laying down. So if your pillow is too high, your neck is up, you can start having neck pain. If you have a nice curvature here supporting the side of your neck, then your neck is straight and you'll have less neck pain. And the same principle for the lumbar spine, you see. And when people ask me, hey, should I get a harder bed? Should I get a softer bed? It's going to be a trial and error system. You have to figure out what exactly is your bed doing in terms of your weight distribution to allow you to maintain that curvature. And if I was to say, if you're going to sleep on either on your belly, your back, or your side, I'd say sleeping on your back is probably the safest bet. Although, I know myself, I find myself in 8 different positions when I'm sleeping. So it's easier said than done. But if you had to pick one, I'd say sleep on your back. Now, another important thing, I can't tell you how many times I have patients come to my office, said, okay, I was helping my friend move, or, I went to pick up the kitty litter in a heavy bag, and now I have severe pain in my back and my legs. And a lot of that's the same principle from text neck, is that as you have a rounded back here, the whole weight of your torso is distributed to your discs here. We talked about how your discs, remember how they're like juicy scallops and how you can wear them down and cause issues? Well, that's an example of how that can happen, is that you lift a heavy load like that, and then all that force gets distributed to your discs. So what I encourage, again, same principle for you see, respect the curvature and make sure the spine is straight. And use your knees and hips to lift. You see, this is correct posture here. And you can see these little vectors they use to delineate how the spine looks when you're bending. This is ideal position of your shoulders and your pelvis and your neck. This is poor posture. You see, again, rounded back. So you want to avoid that. And this nice little video, it shows you how you're supposed to lift here. You can see, again, when they bend down, a rounded back. And that's what you want to avoid. You see here, as they bend down, they maintain that curvature. So that's the key. So that's what I really want to hammer home here, is that it's all about respecting your spinal alignment and your balance. And okay, one last thing we talked about is just this is a small thing, is if you're going to lift anything heavy, be very mindful of rotation, because rotation can actually, not so much your discs, but all your joints in the back, your facet joints we talked about. As you rotate with too much force, you can also have problems with those joints in the back. So that's why it's important that if you're carrying a heavy load like this, use your legs to transfer to the correct position you need to drop the box off, or wherever you need to do with movement. So just to kind of highlight again, it's all about balance. Now, all neck and back problems are related to balance, and that's a balance of your muscles, your tendons, your alignment, all these things to balance together, so that there's less pressure on your discs, less pressure on your joints, so that everything is moving in a fluid way. So the question becomes, when do you see your spine surgeon? That's mostly when things are out of balance, out of whack, as you can say, where for example, you have not been lifting correctly, or you have poor posture, and then there's decompensation in some muscles, and then the pressure ends up going to your discs, and that's when you start having problems. So I'd say when you should see your spine surgeon when you're having neck and back issues that are not self-limited. Let's say they don't get better within a week or two. And the real reason is to get a diagnosis, because really what our specialty is to really figure out what is going on, so we can put you on the right path to back to the way your life was, and to your normal routine. So one if I'm going to simplify it, I'd say anytime you're having any leg or upper extremity symptoms, you should see a spine surgeon, because that can indicate that there's a nerve being compressed. You can see this is the spinal cord, which ends right here, and there's nerves coming off each level, and you see these different colors. The spine gives off nerves to different parts of the body, and you can see that the cervical nerves typically give arms and neck and shoulders here. The thoracic spine, which is the mid-back, gives to the rib cage and across the rib here. And the red and the green indicate the lumbar and the sacral nerves, which will indicate pain down your leg. So for example, when you have that sciatic type pain, typically it's from the spine, although sometimes it can be from the actual sciatic nerve. But in my experience, it's rarely from the sciatic nerve. It's usually from the lumbar spine. And typically any type of problem which causes compression of nerves can cause these symptoms. Another thing that can happen with nerve compression is you can have what's called myelopathy, which is spinal cord compression. Now think of the spinal cord as the way of your brain communicating with your arms and legs, and the spinal cord expands from here all the way down. And anytime you have spinal cord compression, you are essentially interrupting that connection that goes from your brain to your arms and legs. Some examples of spinal cord compression can include problems with balance, problems with using your hands for fine motor motions, weakness in your legs when you stand up, bowel and bladder problems. These are all things we can think about when you're having these having spinal cord compression. So to summarize, I'd say any nerve symptoms, which include numbness, tingling, pain down your arms or your legs, bowel or bladder symptoms, and problems with gait, are things that you should really talk to a spine surgeon about, because we have to first help you understand what's going on, and we can then say, okay, maybe you should try this or that. And here are some examples of common diagnoses that we see. We talked about the herniated disc, and the herniated disc, again, as you can see, this is the disc. We talked about that jelly part inside. It actually ruptures out, or it bulges, or however you want to call it. The idea is a spectrum. The end result is the nerve is being compressed. Again, like the diagram always points, red means bad. So you see the nerve is being compressed, and that indicates pain here. And the nerve can herniate in different parts. It can be in the middle, it can be in the side, it could be in so many different locations. And typically, herniated disc presents with lower extremity symptoms, numbness, tingling. That could be in your arms as well, as we previously described. Another common complaint is that we see in the office is spinal stenosis. Now, this is essentially crowding of the area for the nerves in the middle. So you can see that this is a tight area for the nerves. And how does that happen? A combination of different factors, usually age, wear and tear. What happens is you have bone spurs, which form here from, just the longer you have longer time you spend on this earth, the more likely you're gonna have bone spurs. And as those bone spurs start to impinge on your spine, you start to have symptoms. The most common way patients present with this, they have this pain which hurts in both of their legs when they're walking. And the most common example is that someone who's going to the grocery store, and they say, hey doc, I only get relief when I'm in the grocery store, when I'm bent over my shopping cart. And that's because as you bend over, you're opening some area for the canal. And that's why they have some relief. But when they stand upright and they extend their back backwards, they start to have increasing pain. So that's another reason to go to the spine doctor as well. And then this one is not as common, but it does happen. This is called spondylolisthesis. This is a fancy word for having the vertebral column slide forward. Now, it can happen as a result of a break in the bone, which you're either born with or happen slowly over time, or it can happen from incompetent disc, where the disc is kind of worn down over time, and essentially you start to have sliding forward of the spine. Now, if that happens, what can eventually happen is you can have lots of back pain. You can also have pain as the nerves get compressed, because as the spine slides forward, nerves which sit in these holes here, they get compressed. So what I'd say is, this is a problem that you should definitely see a spine surgeon for, because this can progressively get worse over time, and it's definitely worth understanding this diagnosis in more detail to understand what the best way to proceed is with someone who has spondylolisthesis. So does everyone get surgery? No, I'd say the vast majority of people do not get surgery. And we try a lot of different things. We try, a lot of the therapy that we do, or the treatment we do, focuses on therapy, having a good core, flexibility. Because what happens is, even if our discs are being compressed, we can shield the disc from compression by actually strengthening the core muscles around the spine, so that we are essentially offloading the joints and the discs to allow us to have less pain. So I say a lot of our treatments usually starts with physical therapy. Acupuncture, there's been some studies that show that acupuncture can help with some non-specific low back pain. Sometimes I recommend chiropractic treatment, and that really depends on what exactly the diagnosis is. And more often than not, we always try a course of anti-inflammatories. And the reason why we try that is because a lot of times the pain you're experiencing is directly from inflammation. And what is inflammation? It's when the body reacts to injury. It's the body's way of reacting. Sometimes when that body reacts to injury, it actually generates pain. So that's what inflammation is. So anti-inflammatory medications, which are a bunch of these medications here, actually decrease the inflammation by targeting those cellular processes that cause the pain. So it's not like these are painkillers. A lot of patients say, "Hey doc, I don't want painkillers." These aren't painkillers. They're actually treating the problem. And if these don't work, the next thing we talk about is epidural injections. And this is typically when you have nerve-related pain, not so much for back pain, but when you have pain at your leg or your arm. We can sometimes take a steroid, which is essentially a very strong anti-inflammatory, and put it directly to where the nerve is. And this could provide some temporary relief. It could provide some long-lasting relief. It really depends. And again, these are kind of decisions that you have to make when you talk to your spine doctor. So the question becomes, when do you actually need spine surgery? Well, I like to rephrase that question. I don't think you ever really need spine surgery. There's very rare occasions when you need spine surgery. Those rare occasions are when you have weakness that's not getting better. I'd say when there's spinal cord compression, when you're having problems with balance. These are the kind of things I think about when you need surgery, because if you don't, a lot of bad things can happen if you don't go on the route of surgery. But I'd say for the majority of patients, it's not really a question of need. It's a question of wanting surgery. And that's because I'd say if you're in constant amounts of pain throughout your day, and it's affecting your quality of life, and you've tried everything, then I'd say that's when you probably want surgery. Because at that point, you're essentially sacrificing your quality of life. And a lot of the procedures we do are basic quality of life procedures. They're meant to decrease the pain in your normal activities and return you to a normal active lifestyle. So again, to answer the question, when do you need spine surgery, is not often, but you probably will want it at some point when you tried everything else and things aren't working for you. And the good news is spine surgery of today is very different from spine surgery of yesterday. Now, San Ramon actually has some of the cutting edge technologies in spine surgery, and we utilize robots for putting instrumentation into the back. We also have endoscopic spine surgery, and it's one of the few centers in all of California that actually has endoscopic spine surgery. And this is really exciting to me. It's something that I have a deep interest in. Now, I want to talk a little bit about what endoscopic spine surgery is because I again have a special interest in it, because I did special training just to learn it, because I feel like it's going to change the way we look at and approach spine problems. Now, let me forward this a little bit. So you can see this is a patient laying down. This is a patient who has a herniated disc. And you can see, again, I'll show you that herniated disc right there. You can see this is the herniated disc right there. This is the nerves in the back here. So this is a common problem we see. This patient obviously has tried everything and continues to have back and lower extremity symptoms. So what we do is we use cameras to access that problem, to access that disc. Now, this is an example of the camera that we use. This is the camera. As you can see, the size of the camera is about a number 2 pencil. And what we do with this, and I'll show you the video as we go along, is we target where that location is. The goal of endoscopic spine surgery is to have a precise diagnosis, because we're working with a small instrument here that we want to know exactly where the problem is so we can address the problem with minimal tissue dissection. So as you see, we localize the area, we use x-rays to find the right area, and really the problem and the diagnosis is decided before surgery with either MRI, diagnostic injections, etc. So we first put a needle to where we need to go. Then we make a very, very small incision. You can see the incision is probably less than a centimeter. I'll show you right here. Skip this part. A really tiny little stab incision there. That's it. And then what we do is we then insert a camera. We kind of open up that area a little bit, take a little bit of bone just to open up the area, and then we bring the camera inside. And you can see this is the disc herniation right here. And all we do, took a little bit of bone, and now we can then access this disc herniation here, okay? And you can see the camera goes in, and you can kind of free up this disc. You can visualize the disc herniation. This is the camera here. This is a little area we can put instruments through. You see, and then, you know, I wish it was this easy, but yes, we grab the disc, and then usually what happens is as we take the disc out, this nerve, which looks obviously being bothered here because it's glowing, and after that disc is removed, you can see the nerve is a lot happier. So I have a special interest in this because we did a lot of research in this to make sure that that this technology is actually helping patients. And we did the study that was published in 2019, which looked at, you know, the benefits of endoscopic spine surgery. And really it shows that endoscopic spine surgery is a great alternative to conventional open spine surgery because it has a lower complication rate, has a lower reherniation rate, essentially faster return to recovery, faster, less use of narcotics, etc. And look at the incision, it's tiny. And the idea is it's pretty simple. If we can accomplish the same thing we can do with a small camera, why would we not go down the route of the least invasive procedure to access and treat the problem? It's just, it's not rocket science here. It's intuitive. So again, some potential benefits we talk about include minimal dissection, minimal narcotic use, quicker return to work. I'd say most patients that I do this surgery on probably take you know, Tylenol or Motrin after the surgery for about a week or two. Rarely need to use narcotics. Usually if they have a desk job, they're probably back within a couple of days, maybe a week or so. If they have more heavy, strenuous job like lifting, I put them off work for about 6 weeks, not because they can't return to work, it's because I don't want them to get any further injury, because sometimes that work itself can compromise the disc. And I think overall, it's a great procedure, and I think it's something that it's really revolutionizing the landscape of spine surgery today. So that's it for my talk in terms of basic neck and back problems. I hope I covered, you know, how to prevent issues. Hope you can understand a little bit more about neck and back issues today, and understand that if you ever do have continued neck and back issues and you've tried everything and they're not getting better, there are some great solutions out there that can get you back to your normal life again.
Thank you so much, Dr. Hasan. What wonderful information. I could feel myself trying to, you know, sit up straight just by the information that you were giving. So that's wonderful. Thank you so much.
Yeah,
and
no problem.
Time of COVID, I'm sure a lot of people can relate to that. So, and if anyone has any questions for Dr. Hasan, please head to our website and just go to the Contact Us page, and we'll do our best to just connect you with Dr. Hasan, give you his contact information if needed. And if any just basic questions that, you know, he maybe didn't answer today, we'll make sure that you get answers to those. And then we also just want to preview too our next web series, which is next Tuesday, January 26th, with Dr. Sam Pajam. He's actually a pediatrician, and he'll be discussing various topics related to COVID-19 and kids. So be sure to register for that if you're interested. So thanks again, Dr. Hasan. We very much appreciate your time.
No problem. Okay. Hope you guys have a great day.
Yes, take care, everyone.
All right. Bye-bye.